as we get moving along here. Today's Tuesday, September 8th. Hope everybody had a great weekend and came back to work relaxed and ready to roll, I hope. So since this group last met 2 weeks ago, the leadership team or the coordination team met a week ago to talk about the previous meeting's discussion around goals and purpose and direction. There was, if you remember, there was a lot of conversation around, statements like, I feel like we're still in response, and so that's why we had that meeting with the coordination team last week. Out of that meeting, we sent out just some questions to the RSF coordinators looking for some feedback. So we'd have that, and I got that to you guys if you haven't looked in your inbox this morning, probably 20 minutes ago. So I was able to get it all together for you. But and looking at the feedback, well, we can get into that in a second. The second thing we did was Elizabeth Stevens was on the call as an equity advisor, and there was a task around equity and a more intentional statement around their purpose with recovery, as well as goals for equity. And so Elizabeth took that conversation back to their group. Last Tuesday evening, they had a meeting, so we'll have some time to hear some from that group as well today. But the basic questions that we were looking for the feedback, were talked about the equity advisors, overarching goals, or just individual goals to each RSF. And it seemed like there was a mix from the RSF coordinators on that. Some thought it would just overarching was just good, and other thought that just individual. The structure seemed to be positive. Seemed like expectations, which we've been talking about. What are the expectations? We need to be more clear about what each RSF, where they're headed, the metrics they're using to get to whatever recovery looks like to them. And that was another question in there. As you have an opportunity to digest this feedback, you'll see that we asked those questions. We did get written goals back from, I don't think, we didn't get them back from 2, but that's okay. I think that what we want to focus on over the next couple weeks is getting all those refined goals together, in addition to the metrics for each RSF, and try to ensure that everybody knows where we're going as a group and where they're going within their individual RSF, and as well as what is the mission of equity, the equity advisors, in tandem with those RSFs. So that's the way I wanted to kind of kick this meeting off, and I wanted to give the leadership that was in the meeting last week an opportunity to maybe provide some feedback on that meeting as well, if you don't mind doing that.
This is Sarah. I thought it was a good opportunity just to check in and see kind of where we were. I think, it sounds like, we're trying to recover and continuing to respond at the same time. And that's the situation we're in. I think it's mostly, is this serving the folks, that I think that's what led to the check-in with the RSF coordinators. Is this serving your purpose? Is this serving what you need? I know a lot of energy and steam has been focused on education for unified command for education. And I think that will probably still be in place for at least a bit. So we may go through this conversation again when that changes, but I thought it was a good check-in conversation with the leadership team.
Thank you, Sarah. Anybody else? Craig, Dan? I see Russ, you're on.
This is Craig. Recovery and response are just different things. And so I think it was good for us to renew that. There are so many of the same overlapping players that are doing the work in both of these two spaces right now. And they're interconnected, but they are different. And so I thought it was a good reaffirmation of that, and maybe reorganization of that understanding. We don't, there's only so much of us to go around, and I thought it was appropriate, and I would encourage, if we start to kind of lose track or it's becoming overwhelming how many meetings everybody's in, I think it's appropriate for somebody to say time out and let's have that conversation. That was how I took it.
Thank you, Craig.
Yeah, and this is Bonnie. I would just add that when you look at the recovery team versus the Education Unified Command, EUC is quoted a lot in the paper and in media, and it's kind of the recovery team. So those labels of the two groups seem to overlap a little bit. So in terms of recovery team, if you're talking about the 6 of us, it's not really in people's vernacular, and we don't really think too much about it. The RSFs may be a little bit different, but I guess we're just sawing wood, as Coach Mangino would say, and getting some work done. And I'm comfortable with where we are. It's a healthy discussion, though. I appreciated the meeting last week.
Thank you, Bonnie.
I agree with what's been said, Robert.
Thank you, Russ. Any comments, Dan?
I'm good. Thank you, though.
All right, thank you.
I'll double dip, but I think it's really important to recognize that what we've been experiencing here together too is a lot of the key players in our community and leadership coming together, and that's just a good thing, whether it's in a format of emergency management or not. I think it is something that we found is useful in and of itself. So whether we have a label or we call it something, or it's part of a framework or not, this is something that we should continue to embrace and use and leverage as a community. So I'm excited about that part of it.
Thank you, Craig.
Yeah, and I
Appreciate
guess the only thing I'd add is that, like, I did get a chance to look at the coordinator feedback, and I think we've got RSFs in very different places, and so I would really encourage everyone to read that, and if you're an RSF coordinator, take an assessment as to where you are, and what do we need to do moving forward. So some of you have goals, some of you don't. If you don't, I suggest you get them. and even for with education, with them being in education UC, as if that transitions out of that, what are the goals for that group? And so, I think it's just one of those ones that, if this is really a chance for you as RSF coordinators to talk to us. So if you have questions inside there as to things you want to do, and then we can check in and say, like, I think this RSF's on track. I think this RSF might need a little bit of clarity in terms of what the mission is and where we're headed. So I'm more excited about that piece, and just making sure that it serves you all, and that you have what you need there in terms of that. So I guess I also want to sort of open this up. I don't want to take Robert's part of the agenda, but RSF coordinators, do you have questions for us? Do you feel like you're getting what you need in terms of value from it, or do we need to do something a little different?
Steve, I'll put you on the spot. I appreciate your feedback. I think that you guys may have some questions about direction, and maybe you just haven't formulated them yet this morning. But if there's any, I would just encourage all of you this morning to let's just have a conversation about any of those doubts or concerns, or what if you're not sure what the expectation is, let's talk about it a little bit and give a little bit of time to that.
Yeah, Robert, this is Steve, and I think, and Diane's on as well, so she can speak to this as well and chime in. I think our biggest issue, and I don't know if it's a big issue, but probably the question that we've had, or maybe the difference from rather than maybe the other three groups is they were already pretty much formulated from the beginning of the pandemic as part of the emergency response. And our group was more of a discussion group that it initially started as economic impacts group, where it was really just sharing of information so that people kind of knew what was going on and could get a sense and perspective from other parts of the community, other businesses and other types of industries, what was happening. And it was kind of later in the game as we evolved into the RSF. And so I don't know that we're not doing well. It's just we started at a different place, a little bit behind where everybody else was, and we're still formulating, to be quite honest. I think we're kind of in a catch-up mode. And one of the things too that's been a little bit different for us is, at least in my view, is when we've been working on our metrics and trying to define the metrics, and our group is pretty diverse, and it's really hard when you have a lot of folks who have very strong feelings about their part of the economic picture to get it honed into 3 or 4 or 5 or 6 metrics, because everybody wants to be sure that their particular piece of the economic picture is definitively represented. And that's really hard to do. So we've been kind of struggling with that. We've been working with the folks at KU on a number of metrics, and they've done work for Johnson County and Neosho County, several other counties, and we're trying to get that kind of honed into something that is universal enough that we can use something that they already have kind of a precedent set for, and not have to reinvent the wheel, and make it representative and have it be measurements that are meaningful, but not have it be 27 pages, which I think there are some in our group that would like to have a 27-page report, which isn't practical. We need to have something, at least our little leadership team, we know we need to have something that can give us kind of basically it's like a desktop or just a scan, and you can do month-to-month or ongoing reviews and see where you're at, and you don't have to have a degree in economics or have the time to read 20 pages of material. And so that, I think, has been part of ours. And then we've also been trying, I think, another piece of where we've been, and I think this is appropriate, and this is part of one of our goals, is we've been working very hard at trying to identify resources for folks within the community, because I think that is one of our purposes and should be one of our objectives, is to try to find resources to support our business community and our community in general. And so that's been a lot of time, and I know Diane and I and others have been very involved in trying to help get people access to resources. So I don't think that it's that we're not doing well. It's just we started in a little different place and are probably a little bit behind where everybody else is in terms of the other RSFs.
Thank you, Steve.
I might just add that I think that one of our initial charges as an RSF from this group, I believe, was kind of to restore the community to its prior state. I forget the exact wording of it, but that is a very large challenge, and probably what we need to do is have some exercise where we are more honed in on what the goals are, at least immediately. I think that the metrics will be of help to us, and maybe that is something that the leadership group can help us define here as we get the metrics together.
On that end, one thing I might say is that, yeah, it's kind of a chicken or an egg, which comes first, the goals or the metrics, and the metrics or the goals. And I would say that one of the things I know, like RSF3 did was, it's not all of human services. They set up a pretty clear 3 areas that they're working in. And then they focus their metrics and goals on those things. And so I think that might be a strategy when we have these really broad areas like economic impact to business community. So, what are the specific areas you're working on? And it is tied to the pandemic, and then that might help. I think you guys did a really good job in your direct aid plan, the goals that you established for the development of the CARES Act proposal. And, maybe that's just strategy is to kind of go back to those. And it doesn't mean that others can't participate. It just means that, you know, that's the focus. Does that make sense?
It makes sense to me, Sarah. I think, you know, one of the things I wanted to talk about was as we talk through this meeting today and the information from last week is to go back to our original document that outlined what this group was going to do. And I think that, you know, Diane and Steve, if maybe over the next week or so, we can maybe get on a call and maybe talk through you know, what those goals are and what the metrics are, and maybe we can get it down and something that's a little more smaller to chew on and work on. And but I would offer that to you if you wanted to meet with me and Jillian and whoever else could help in that group. So
Thanks, Robert. We'll take you up on that.
okay, all right. The other RSFs, Tracy, I see you're on. Did you have any comments? She wasn't on. I don't see Tracy anymore. And Beth's not on. Jill, I see you're on. Did you have anything?
No, I don't have anything. Sorry. Not unless any information was needed or any updates needed from me.
Yeah, specifically, you know, around where you're headed in your RSF and your goals. I know you had I shared your goals again with everybody this morning in that email I sent out. But
Yeah, I'm sorry. I'm sorry about that. I got momentarily distracted. Today's first day of virtual learning. No, I think just our focus areas have been the same from the beginning. We continue to make progress. I think what I can get value from this group on an ongoing basis is just making sure that we're on the right track. Kind of what Sarah said a couple minutes ago, to just validate that we're on the right track or give us some feedback on areas that where we should modify so we don't get so far off track that when we get to a certain point, we're told this is a terrible idea or I have concerns about this, things like that. That would be incredibly helpful. So yeah.
thank you, Jill. Shannon, do you have anything to add?
The only thing I'd add is that sometimes somebody else may know something that maybe we're not aware of in a housing situation, and that just probably let us know if there's something that comes up in that way, so that we can reevaluate our goals. But we definitely kind of have an eye out and are monitoring the things that we know about and meet regularly. So, but there may be things out there that we just aren't aware of, and so just give us a heads up if if the chamber hears from some private landlords that they're having some kind of a problem that we could put on one of our agendas to make sure we're covering the full spectrum of the housing issues.
Thank you, Shannon. Andrew, you may be the only one on. I think Julie's, I got an out of office on her this morning. Andrew was on, there he is.
Yep, I'm still here. Good morning, everyone. Julie's been doing most of the heavy lifting within this RSF. I've been a little distracted the last couple of weeks and hadn't been as engaged as I would have liked to have been. But I'm hoping to follow up with her this week and get a better sense of where we're headed as an RSF. I didn't see any major themes that kind of reached out from the documentation that I've seen from you guys or from her. So but unfortunately, I don't think I could speak too intelligently about the status of it.
Thank you. I'm going to share a screen with you real quick. This is kind of, is it up there yet? Yeah, okay, cool. So this is the original document that we started with, and And new stuff there in the it's highlighted is some language that we added over the last week, and then just talks more about recovery and helping us understand what it is. And if you'll see in the goal, we added equitable in there. We talked about that at our meeting last week on how can we include that in our overall mission goal. And then recovery team responsibilities, the things that are highlighted there. You'll see the word resiliency in there as well. If you want to just look through those, and then some assumptions about planning for recovery. So really what I would like to do over the next, before we meet again, is to have an almost final version of what this is. And that may take some meetings with individual RSF coordinators, ensure that we have their roles and responsibilities clearly defined. We have their, at least the goals for now. I mean, goals will change, and then it may be a good start into those metrics and have that sent to you guys before we again review. And then I just want to introduce this right here. Couple graphics. You guys see those? Yeah. Hey, Jillian, and I just want to show this just to kind of introduce these. I know we showed the top one, the first one last week to the leadership team, but we want to work towards combining these to come up with something that really works for us and that we can all understand. And Jillian, if you don't mind just talking a little bit briefly about these two.
Sure. It really struck me when Sarah mentioned, I feel like we're still in the disaster part of the top graph. And so it did a little bit more, we did some research over the weekend and this last week after that meeting, and really looked for something that better showed sort of responding to a pandemic. So the top graphic is a traditional response and recovery to a disaster. So you have your disaster like our tornado, our flood, and then the short-term recovery starts in the middle of that disaster, and then we start looking at the other intermediate and long-term recovery. So ideally what we'd like to do is take and work with our RSFs to fill in some of the pieces at the bottom here that talk about what does short-term recovery, intermediate recovery, and long-term recovery look like? What are the actions that we're taking in those phases, whether it's immediately after we have a spike in cases and things change, or as we're on that downhill, and then as we look at what's that new normal for our community, what does the future look like? So we can start putting in some of these goals to work toward with a time frame, and maybe that will also help kind of what Diane mentioned about, we want to, put the economy back. So what does that look like maybe in shorter term goals? And then Robert, if you move to the second graphic, this one really, I think helps show what life is like in a pandemic. And I borrowed this from an article that was written. So basically where we want to be, where we feel like we're managing the pandemic is kind of that trigger point, dotted line. And then you'll see we have spikes. And as the cases increase or we have outbreaks, we move into that more of a response mode. And then as we sort of manage the mitigation factors that we put in, the cases start to come back down, and we fill up. So we replace all the supplies that we used in that particular response to those cases. Those are the new executive orders, any changes that we make. And as we come back down to that downhill, and we get below that point where we're comfortable, we're still working on long-term, short-term goals for recovery. And so you'll notice that there are some disruptions as we have additional cases, and we get a peak in the number of cases that we have. But that theme at the bottom continues for recovery. We're always looking long-term. It may just be that current circumstances, we're going to respond to things and there's less going on in recovery. And then as that response comes down a bit, our focus and our actions that we're taking for recovery might come up. And that's where the planning assumptions come in. And as you look at those, we recognize that each function and then each segment of the population may be in different phases at the same time. And they're going to experience response and recovery differently, and really on different scales. And so that's why we wanted a graphic that sort of helped show what the spikes looked like and what we were doing in between those for response and recovery, and then to set those assumptions so that we all come to the table with a similar set of knowledge that this is what our expectations are. We know it's going to look different. We know everybody's going to be kind of in a different place, but this is how we're making our way through this process. So that's where we thought maybe this would be a little bit more helpful. It might be something that would be helpful to show the community as well, put on the website with our actions, but with that up and down to help them see why we're using the word recovery, but we are still responding to those spikes. So, and I can share the article with you guys. I thought it was just a really different way to look at it, and reading a lot of pandemic plans and recovery plans, trying to find a good framework for us to feel comfortable in, some sort of kind of structure and knowledge. So I can share that article. Craig, I saw your question pop up there. So I'm happy to send that. We can, I can try to grab it and throw it in the chat box once I get done, but hopefully that maybe helps clarify things a little bit better and looks more like what we're doing than maybe that traditional graph of disaster and it ends and then we move into recovery. So hopefully that's helpful, and that gets us something that we can all kind of grasp, and the community maybe has a better grasp of for what actions we're taking.
Thank you. Thank you, Jillian. Any questions about that before we move on? I wanted to give Elizabeth an opportunity to share with us what her team talked about, or their team talked about last week. So Elizabeth.
Yeah. Thanks, Robert. And good morning, everyone. So I wanted to kind of to give kind of a short recap, really on some of the conversation that we had, the leadership team, as well as the equity advisors. So one of the common themes that we had throughout both meetings is that, we have this great opportunity to implement some framework into the recovery and response for the county that really stresses the importance of equity and moving forward in an equitable manner. So looking at how do we do that? There was lots of conversation about developing this framework. So when we're looking at this opportunity where we are just starting to identify goals and we're just starting to write this framework, how do we embed equitable language into that framework? So and make that, do it in a way that has easy to identify action steps. So the equity team got our framework. How do we get those things together? And we've kind of started the ball rolling. There were some really great tools that were kind of shown to us on some things to focus on and how to break that down. And I'm sorry, I'm distracted. I have a crying child in the other room. I apologize if y'all hear that. But really what we want to do do we want this language to be embedded in just the overarching framework, or do we want it within the RSF, each RSF? And to us, that answer seems pretty clear, and it seems both is the answer. And I don't know I know that there's always a concern about whether or not this is too much work or more work added on to people's plates. However, I think that, among this group that we all have a common theme and a common goal to make sure that we're doing things in an equitable manner. So if it takes a little bit more time, maybe, but is it worth it? Absolutely. So we're here, we're ready to help. The equity team is working to put together our specific goals and helping put together some of that language. And I guess some of the questions that I have, for this group is, what role is your equity advisor playing in your development? So for instance, Steve, you mentioned, a lot of work that your RSF is doing. And so I wonder, how can we as equity advisors be more helpful in that process? No, nobody wants to reinvent the wheel. So how can we be more helpful? And are there some things that you've come across that you'd like us to read? We're always happy to look at those, look at other options and to see what other communities are doing. So I kind of rambled on a bit there, but if there's any questions or if any of the other equity advisors have anything that they'd like to add, please do.
This is Erica. Thank you for that summary, Elizabeth. So I agree with what Elizabeth said, and I'd like to challenge this group to really look beyond returning back to pre-COVID state. This is an opportunity to really reimagine what our community really could be, and to also, like Elizabeth mentioned, have that equity piece be infused throughout our overall plan, and then throughout each individual RSF. So it's really a great opportunity to really narrow those gaps that have been existing in our community for quite some time, and just make this a better place for everyone to reside and live. So thank you for that, Elizabeth.
This is Sarah. I guess I have a question. So I guess my assumption is if there are overarching equity goals that would be developed by the entire equity team, by the entire coordination team, not just the equity advisors. Did I hear that wrong?
I think so.
Okay.
So we are putting together, so we have, goals within our group. What are our specific goals, our specific group goals? And then how do we then come together with Robert, Jillian, whomever, and put some of that language into the entire teams, the recovery and response team's initial framework? Does that make sense? Am I saying that in a way that?
I guess go ahead, Robert.
No, I was going to say, I think what Sarah was getting at is that, are you going to work with the RSF as you come up with those equity goals within each RSF? I agree that, we need that overarching that you're talking about, and we can get that and meet with you guys and get that into our framework. But I think, that's what Sarah's saying is are you going to engage, or is it just going to be your team that's going to work on those goals?
Yeah, we are, okay. So we're always happy and ready to collaborate with anyone, with any group. So anyone, just like the leadership meeting, that's a perfect opportunity that we were excited to have the opportunity to collaborate with the leadership team. We would love to have more equity advisors be involved in all of those meetings. So and vice versa. So if you have feedback or you have input that you would like to bring, we're absolutely open to that collaboration. We just want to bring something that says, hey, we've done some of this research. Here's what we have. How can we work together to make it even better?
Robert, this is Casey. I might chime in and add to elevate some of what Elizabeth was talking about. That it's hard for the equity advisors to advise the RSFs when they're not engaged. And as Sarah mentioned, the RSFs are at different stages, and I think the engagement of the equity advisors has been somewhat different too. And so, Robert, you mentioned visiting with each RSFs to kind of refine those goals and that initial framework. maybe that's a way that these equity advisors could also be engaged in the work of the individual RSFs. At our last meeting, we kind of talked about, okay, if we take that initial framework and go through it and say, okay, I'm the equity advisor to RSF 3, I'm going to look at the chunk of the framework that relates to that RSF and then try to embed that equity language like Erica was mentioning. To me, the most successful way for that to happen is that conversation be between equity advisor and RSF leadership. I see a couple of nods. So that's kind of the way that I think makes sense to head forward.
Thank you, Casey and Elizabeth.
Yeah, and I think you're right on, Casey. I would say though that like everybody's in a different place. So if an equity advisor feels like it's not getting what it needs, like that's the kind of information to push up to Robert and to Jillian, you know, and I'm not, I mean, RSF4 is like swamped, you know, they're inside UC and they're doing tons of stuff. So, but yet we have an equity advisor inside UC for education. So maybe, and that's Dr. Stubblefield with USD 497. So maybe it's those equity advisors could help assist her in that work. So I think we just need, I mean, I'm not a big fan of one size fits all. So I think we need to come up with strategies. I guess what I was also saying though was if there are overarching strategies for the entire effort that the equity team is going to work on, I think working with Robert and Jillian is a great place to start. If you're looking for volunteers from leadership to help bounce ideas off of, I will volunteer. I'd be glad to be a part of that process because if we're going to have it for the large goal, for the whole team, I think it would be good to kind of check in with the leadership team as those are developed. And I'm not quite sure which you were planning to do first or do them at the same time, but.
Sure, and I think that I think that we've engaged, at least I personally have engaged with Robert and Jillian kind of having, so I think that we're, hear you say that connecting with them is a great place to start. Fantastic. That's where we're at. And then, you know, moving further, you know, and I'm also happy to hear that you're willing to be another person to bounce ideas off of. Just on behalf of the equity team, you know, we're here, we're committed, we're ready. And we have an incredibly capable group of people. So we're excited to get involved and to get engaged and really see how we can all build on this opportunity and collaborate together. So thank you, Sarah.
Okay, I guess as we move forward, we'll connect with the equity team, and then I think Casey, I think that's a really good idea. Is to, for sake of time, even to have those conversations with the RSF coordinators. Jillian and I can meet, and then we can include the equity advisors as well, and maybe try to make some progress in those meetings. Anything else on equity with the equity advisors? I wanted to just, if there's anything to report out on in your work and recovery, I wanted to give the RSF coordinators an opportunity to do that. If there's something that we need to share with the group, Steve, or anything from Juan or Diane.
I don't think in particular. I think I spoke a little earlier about some of the things that so I think we're good, Robert.
Okay, thank you. I don't think anybody's on, unless Russ, you had anything that needed to be talked about with health and medical services.
Not additional, I don't think, unless people have questions or suggestions.
Okay, thank you, Russ. And Jill and Shannon for 3. Anything to share?
I would just say that we continue to have our RSF3 meets every 2 weeks. That's our regular schedule. We'll stick with that, but we do have subgroups that meet in between. certainly areas of one that I'm meeting most regularly on is related to the sanctioned campsite. We have a work group that meets on that. We have a larger stakeholder group, and we have a subgroup that meets on that. That's moving forward. Moving forward with housing stabilization and exploring the creation of an eviction prevention task force, which is a model that a lot of other communities are embracing to try to stem the tide of evictions. Even though there is a moratorium on them for COVID-related evictions, we still think that it's an ongoing strategy that the community needs to have in place. And then just more monitoring some of the other the two other focus areas, and connecting with the resources at the public health department in terms of answering questions that come up for some of those congregate site food support organizations. But always happy to stand for any questions. And I don't know if Shannon, you have anything to offer from the perspective of Housing Authority?
Okay. Is she coming back to us, or she's okay? I think Shannon's good. Andrew, anything to add? I don't see Julie on.
No, nothing to add for me.
Okay, thank you. Anything from finance coordination, Jeremy or Brooke?
Hey, Robert. Good morning. This is Brooke. We have not heard anything back from the state as of today. Widely across the state of Kansas, most of the plans, they're categorizing the plans. You either get a red light, which means this is not an eligible expense, an orange light or a yellow light because they need some additional information, or you get the green light on your plan, and it can be a combination of those categories. So I'm still just waiting to hear back from them about our plan, but as soon as I do, I'll be reaching out to all of the primary contacts for the recipients of CRF funding. And that's pretty much it for today. I'll stand for any questions.
Hey, Brooke, has there been any feedback at all from the state on any of the programs?
No, you know, that's a really great question. I'm on a listserv for the folks who have submitted the plans, the agency contacts for all the counties in Kansas, and it seems like widely the main thing that's getting flagged on the plans, and they're not saying no, so they're not getting a red light, are some of the payroll items, and that seems to be what they're questioning the most, from what I've gathered. A lot of counties have received their feedback already. So, I know the plan that we submitted included 55 programs. So there's a lot to kind of pour over as far as our plan goes. But yeah, I mean, it seems like people are starting to get their feedback, and it looks like some of those payroll items are the ones that are coming up the most, and they're not saying no, they're just cautioning people that it has to be for certain payroll expenses. Did that answer your question?
Yes, thank you, Brooke. I appreciate
Yeah.
that. Anybody else have anything for Brooke? Logistics, Charlie, are you? Yeah, you're right there.
Right here, Robert.
Right there on my screen.
I have just two quick things. On the state contract with Battelle, it's expected that they're not going to continue the contract, so it will expire at the end of this month. There's been some discussion with Kansas City area hospitals about possibly working together to work directly with Battelle, but nothing tangible has come out of that, just a discussion they had last Thursday. And then the hospital, Pat Tabor at the hospital had been working with Vizient, which is their group purchasing organization, to find an arm of Vizient that allows, basically allows for local and local government contracts. And he's still working that process. They've found a different partner that we think we'll be able to work with. So that's positive news. And that's all I have.
Hey, Charlie, do we have any sense that the state dropping Battelle will put a crunch on N95s?
There's been an increased use of N95s more recently. So I think that that's probably a concern, but our stockpile of N95s is still pretty high, especially compared to the other PPE that we have. I honestly think we got to just be careful as we move forward to pay attention to the weekly numbers. And, you know, early on, we had elective procedures that were being discontinued and all that conserved N95 masks. And I think as everyone's trying to operate as normal and address COVID, it's really increasing the amount of PPE overall that's being used. And it's not easier right now to find N95 masks. So we haven't seen a big change in the supply chain. I don't know if that fully answers your question, Russ.
Yeah, I just expect to the extent that it was re-sterilizing a lot of N95s, if we don't replace that capacity, it should make the problem worse, I would assume. Pat may know better than I do. Also, just FYI, the hospital now, we can no longer use cloth masks in any of our contexts, so we're having to convert to procedural masks in all areas. That's not necessarily an N95, but you know, even like for yours truly, if I go out and make rounds or visit with people, meet with people, we now have to use procedural masks, not cloth masks.
Okay. Those are not as hard to come by. Saw a whole bunch at Home Depot this weekend. I think they're bundled in packs of 50 for $20. So they're not surgical masks, but what you're referring to are those 3-ply procedure masks. They seem to be available to most people.
And Charlie, if I can jump in real quick, the reason, just as a reminder, the state is dropping their contract with Battelle is because they weren't processing enough masks overall. So those can do 80,000 masks a day. And I think we've done like 20,000. And so the state just didn't see the advantage of continuing to do that. So just if people are wondering why, they just weren't processing enough at the time. But Russ, you're right. For those that were using it regularly, it's definitely going to cause an issue. But that's why they're canceling the contracts at this point.
Thank you. Any other questions for Charlie or logistics? Do you have anything, George, Carrie?
I just have a few brief things, Robert. A lot of the PIO communication has been, not all of it, but most of it toward the response with our case situation and just that continued messaging on things that we were doing in the response as a community and then that similar like smart and safe habits for individuals. We did more videos the past couple of weeks, I think, since we talked, especially to get some of our doctors out there, just that medical and science epidemiology based messages for people in a different format on what's happening right now, why we're doing it, things that people can do. So I want to thank Dr. Scrumsher and Dr. Marcelino and Sonia Jordan. And then a lot of our communications the past week have been around the in the Education Unified Command, that phase color going to yellow over the past couple of weeks, and then the updated health order last week. We did, the Lawrence Douglas County Health Board last week did approve us extending our campaign that we had through public health, that I'm working with the PIOs on the messaging and the creatives for social media and digital messages aimed at college age populations on smart and safe habits, and then just that our community depends on you. And then rolling out the parents of the K through 12 students on that science-based advice and making decisions for your family in school and things like that. We actually have switched to Great Plains Media for the next phase of that next 2 months. We have a meeting with the PIOs this afternoon. So it'll be digital, social media based, and then that they'll manage for us, and then also a lot of radio advertising in the community, especially geared around the sporting events that might be happening, their coverage, things that get a lot of attention, and then the K through 12, like especially like the high school, not even just school or athletics, but academic events, National Honor Society, things like that, where a lot of parents will be and students will be likely listening or paying attention to that type of content. So we're excited to get started on that.
George, I just have a quick question. Are those things available in additional languages also?
I believe the content related to the campaign so far, I don't believe we've done that, but yeah, that's a good point. We can bring that up today, especially as we're switching to if we go a different direction. Yeah. Sure. We do have a lot, I'm sorry, a lot of our general messaging that we've had mostly in-house through public health over time is in additional languages, but.
I see. Okay, thank you.
Yeah.
Hey, I would just take this opportunity to just tell this group, George and the team on the Education UC have been like leaping tall buildings with a single bound. And I really need this team to help share that message out. So if you see social media posts for your organizations that relate to this, please help us get the information out. Or if there are things that, because you are a broader group than the Education Unified Command. So this is probably an area where we could step up our work, where how do we get this information out to our network? So any RSF coordinator, you got an email list, let's get them, how can we share this information? I'm constantly hearing from people who just are dying to get up to date, good information. And we've been focusing a lot of efforts inside Education UC, but it should go to every economic list. It should go to every housing and human services list. It should go to, everybody, not just education at this point. So if you are not getting that information and you want to make sure you get it, please get with George and Carrie.
Thank you, Sarah. Anything else for PIO group? And Casey, any last, anything else for equity?
I don't think so, unless anybody else that's on the call would have anything.
Not seeing anybody have anything for the good of all? All right, thank you. Thank you for your time this morning, and we'll be in touch soon. We're scheduled to meet, we talked about extending the time frame for this group. I'd like to meet at least one more time in 2 weeks and come back to the table with the work that we talked about this morning, these action items, and then maybe from there talk about putting it a month out, if that works for everybody. Cool. All right. Thank you. Have a good rest of your day. We'll see you.